Good morning. Welcome to another episode of PI Today. I'm your host, Dr. Nicholas Loloee. We have a very special guest today.
Aloha, I am Connie, your smooth operator. Welcome back to PI Today, where we blend together health tips, expert insights, and education from our top doctors. Today, we've got a smoothie that's going to blow your mind and your taste buds. It's called the Blueberry Mango Mind Blower. Not only does this smoothie taste amazing, but it's packed with benefits that are perfect for anyone on the go recovering from an injury. First, blueberries. They're not just delicious, they're loaded with antioxidants. These little powerhouses help reduce inflammation and boost brain function. That's right. If you're dealing with recovery from an accident, this can help support your healing process by reducing oxidative stress in your body. Plus, blueberries are great for your heart, giving you a double dose of health. Next up, one of my favorites are mangoes. This tropical fruit, it's not only sweet and juicy, but it's packed with benefits. Mangoes are loaded with vitamin C, which is key to boosting the immune system and aiding in tissue repair. This is especially important if you're healing from a brain injury. Plus, mangoes are rich in vitamin A, which supports skin health and helps your body heal wounds faster. And let's not forget the collagen and protein. I always add those because collagen supports your joints, skin, and tissue repair, while protein helps muscle recovery and helps you just, feel energized. Together, they fuel your body and help heal and strengthen. So whether you're recovering or just need a tasty, nutrient-packed boost, the Blueberry Mango Mind Blower is your go-to. It's all about fueling your body for that journey ahead. Thank you for joining me in my mangoes. And don't go anywhere, because up next week on PI Today, we've got Dr. Shirin Ansari.
In our former episodes, we were interviewing Dr. Rod Amiri, psychiatrist, MD, talking about traumatic brain injuries. And in that episode, we touched on the management of psychiatry and what it does for traumatic brain injury and their patients. Today we have a really wonderful academic guest, Dr. Shirin Ansari, PhD, a neuropsychologist. She has come to get us familiar what a psychologist does for her patients. So Shirin, thank you and welcome on PI Today.
My pleasure.
So Shirin, tell us about yourself, tell us about your education, what have you done, what are you doing today, what type of patients do you see, people who suffer from traumatic brain injuries. Kind of get us familiar with your life and your professional life.
Got it. Well, I began my career as a psychologist, my undergrad work, psychology and biology, my fascination with science, obviously. And then I kind of became interested initially working with children and adolescents just because so much happens during those years of child development, from trauma to the brain having difficulty to process information and developmental disorders, and that kind of transitioned into working with adults as well, especially looking at genetic factors. Often what I would notice was that what we would see in children or adolescents had a lot of similarities with what had happened to the parent, for example. So I transitioned into private practice, and I always had the mindset that the more brains, the more resources, the more disciplines that come together as professionals, we do a much better job, because more data means more options for treatment. So with that, I started a private practice that was really based on that whole multi-disciplinary model, kind of bringing neuropsychology, clinical psychology, developmental psychology. Really, my purpose, or my team kind of grew, so I should say our focus became kind of understanding how the brain works, especially if there's been injury to the brain, looking at the baseline data based on the information that we were gathering, and then looking at either the onset of a difficulty in information processing, or as a result of some kind of trauma, whatever that is. So that kind of led us to really expanding our model, looking at collaboration, which is an absolute necessity when you do have a multidisciplinary model, looking at a lot of data, working with psychiatrists, working with neurologists, working with family practitioners, other service providers. And that model kind of grew, and it led to having multiple clinics. And as we gained more knowledge, the whole concept of understanding the brain, its limitations, its capabilities, and then how it translates into daily functioning, your ability to process information, to function in society. So that's been my professional journey and my team's journey for the last 20 some years.
Wonderful. And I've had the pleasure of reading some of your reports, especially on the traumatic brain injury patients. Um, what type of assessments do you give these patients that you see that come in? And of course, it has to do with the severity of each patient, depending if they were in a mild, moderate, or severe traumatic brain injury. So, how does your assessment work? How does your diagnosis work? Kind of take us through that when you see a patient.
I think at the outset, having a lot of background information. I think as a clinician, unlike the current medical system where everything is done, fast, 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 I think when it comes to our particular field, taking the time to understand what's been going on with a patient, especially if there's been a traumatic experience or the onset of some kind of disorder or what have you. It really doesn't matter what the presenting symptoms are at the outset, because the beginning of a process of understanding a patient is really understanding the patient in all facets of their life, looking at interpersonal relationships, looking at information processing, looking at social skills, looking at executive function abilities. With executive function, I mean really the frontal lobe being able to process information, being able to organize information, analyze information, synthesize information, archive it, either in short term, working, and long memory capacities. So, to run into an assessment at the outset, I would say is not the most sound approach. So, taking that history, gathering as much information, let's say the patient has had some kind of a traumatic experience, looking at their functioning before the trauma, that's critical. So taking the time to gather that data, not just from the patient, but those who've interacted with the patient. For example, employer, a spouse. If it's a college student, looking at the college professor, if accessible, connecting with the employer. So gathering that data really does help us to look at what's going on in the here now, looking at the deficits, looking at regression, looking at deterioration of symptoms. So that's really the first part of our assessment, which really requires taking the time prior to even meeting the patient. If there's been an MRI, if the patient is working with a psychiatrist, with a neurologist, radiologist, looking at all the data even before you meet the patient. So the questions that you asked are informed questions and not just what's wrong with you.
Excellent, excellent. And when you are seeing these patients, I've noticed that depression has a lot of tentacles, and these people struggle after traumatic brain injury with depression. How do you get them back to normal or better functioning, high functioning, low functioning? How do you assess them, and how do you get them back to their normal quality of life?
Wow, that's a very loaded question, and it happens to be a definite area of interest for me personally, because very rarely you see one medical issue or one mental issue being the only issue. there is a lot of, as I'm sure you know, coming from science and medicine, there is a lot of comorbidity. So to think that the body is disconnected from the mind, and to think that the body has its own system of functioning without that connection to our social emotional being, that part of our existence, and also the cognitive part. That's, to me, that's unethical. So first of all, taking the time to really look at the impact, not just at a cognitive level. How is your memory? How is your executive function? How is your follow through? Any type, we know even emotion regulation has to do with like impulse control. And then you get in trouble. Like if your brain cannot process information accurately, efficiently, reliably, it affects you because you're interacting with society, right? If I'm working, or if I'm a parent, for example, if I'm a student, that trauma definitely has an impact in how I conduct myself. And as a result, it affects all my interactions. Now, the more severe the difficulty in terms of what's happened to the brain, a higher level of having consequences and having side effects. I would say in my field, even prior assessments, prior treatments, prior diagnoses, they need to be looked at very carefully. Very rarely patients realize there is interconnection. Even looking at interpersonal relationships, a lot of times, as I've worked with, I want to say thousands of patients, have been doing this for 2 decades at least, marriages. And if you struggle in your marriage as a result of some kind of injury and trauma, and you're not able to function as a parent, as a spouse, as a daughter, as an employee, of course, it's going to affect your ability to function on a social emotional level. So to think that this is TBI, or this is whatever that's going on in the brain, without really understanding how these systems interact and they're interconnected, to me that's a mistake. I very rarely see patients, you would think moderate to severe TBIs would have a higher impact. But what I've noticed is with mild TBIs, because the symptoms are subtle, or at least you don't notice it as well, you kind of attribute it, oh, this happened and I'm going to get better, not realizing what the impact has been, especially when it comes to your cognitive resources. So you end up blaming yourself. You end up blaming your spouse. You're not patient with your child. You can't do a good job of parenting anymore. Your time is not utilized efficiently. Your nutrition, your household, your children's. So it's like it affects every aspect of your life. And especially nowadays, a lot of people struggle with anxiety and they function beautifully. But when you have a stressor externally that's not expected, it definitely impacts your social emotional functioning. So those symptoms become as important as looking at cognitive rehabilitation, kind of working on those cognitive deficits, and patient education.
That's right.
Because we know through metacognitive processes, when even working with children, I've done a lot of work in clinics and with a lot of parents who've dealt with children, we know that the best route for treatment is metacognition. What does that mean? That means the patient's ability to think about their own thought processes. So, for example, if I know I struggle with memory, hypothetically, and that happens to me a lot these days as I'm getting younger, obviously. If I don't know about it, if I don't get that feedback, if somebody does not take the time to educate me, Shirin, you're doing things differently. Why have you become so anxious? Why are you so irritable? Or how come you're always late to work? How come you forget? So if I don't know that's going on, sorry. if I don't have an understanding, we refer to that in the world of psychology as having insight, being able to reflect, being able to look at your own system globally in all aspects. If you have no clue, how could you be committed to a treatment process? So that whole metacognitive mindset that needs to be really transferred or imparted onto your patient is as critical when it comes to treatment. And then taking the time to present the test results and to do a good job, not that you have this and you have that and we are going to give you this and that, really substantiating the data, not in a super psychobabble form, but in a way that's meaningful to them. This is how you performed before. This is how you conducted yourself in your work. And we see now that subsequent to this injury, subsequent to this trauma, we see that there are deficits. How do you think this happened? Where do you see the deficits? So that connection between the clinician, the data, basically not just somebody saying you're this and you're that, but data basically substantiating this is what's happened. We are going to be working on A, B, C of these. Which one would you say is a priority? Your marriage, your work, your children, triaging the patient, but educating them.
Right.
Because you can't work on 10 goals at the same time. It's overwhelming.
Exactly. And you mentioned something that is very common in the traumatic brain injury world, which is mild TBIs. And a lot of these patients are a little bit, how do I say, a little bit lost because it's something you don't see. It's subjective in their mind, right? They're less than 1% of traumatic brain injuries have bleeds. So, their behavior becomes the focal point of their injury. And this is where neuropsychology is so important because it is a diagnosis that is not seen until you get into the patient's before and after type of life. And this is something that that these poor people who suffer from it, they're dismissed. They are told that it's all in their head. They're struggling with their family. People lose their jobs. The kids don't know them anymore because they're more violent or more aggressive. So how do you get these people back to a semi-normal life and letting people believe them that, hey, they suffer from this. And I've seen countless of people in this profession that are just completely dismissed.
Absolutely. Like I said, gathering relevant and accurate, it's an ethical responsibility when it comes to any clinician who is entrusted with making the diagnosis. To do that, you need to be committed to collecting as much data and through other historians. So let's say in your scenario, if the injury is a mild one, you go into it knowing you have to do a very good job of not just gathering information from your patient, but also other providers. If you have an imaging, if you have imaging results, if a psychiatrist, if a psychologist, even those that interact with the patient, taking the time to talk to the spouse.
So that's very important.
Very important.
Because a lot of relationships gets ruined with traumatic brain injuries, whether it's anxiety, depression, PTSD. Do you also involve the community that's around them, and how do you do that?
Absolutely. I think it's important. Well, it depends on the family structure and their support system. So typically, when the level of stress within a household is higher, you would have more of a likelihood to engage the support of the person's community. However, if everybody's dismissive of what's going on, then you have to be a lot more strategic to, first of all, educate the patient, because they themselves, they become very hypercritical because they're not getting the validation and their world is turned upside down. That's where the depression and the anxiety, the question you were asking, like, what's wrong with me? Nobody believes me. My boss doesn't like me. Why does my husband pick on me? How come my kids don't listen to me? How come their grades are going down? How come I can't help my child anymore? My sister, I'm not returning calls. I forget to do this. I forget to do that. So, and because it's mild, you can't automatically kind of correlate it with that or look at a causal or even a correlational relationship. So again, it really falls on the clinician to collaborate with other providers. And I would say with mild TBI, having multiple disciplines work together, because as we know, for example, neuropsychology has its own limitations, subjective measures, confidence intervals for certain tests. If I'm looking at cognitive processes, you have confidence intervals. Who's to say that your test results are 100 times accurate? No such thing. So, and then when it comes to imaging, like you said, imaging does not always pick up on the more overt symptoms. So having a team come together, taking the time, and not rushing it because you're writing a report and you gotta, turn it into insurance company, for example, or an employer to clearing the patient to go back to work or not to go back to work. You need to cross-validate. You need to reach out to your the providing psychiatrist. Even physical symptoms, connecting with the chiropractor, connecting with the physical therapist to see how that patient is, what those presenting symptoms are, how they're responding to treatment, and also how that provider perceives that patient. Does the patient have good follow-through? Does the patient show up on time? Does the patient follow through with your instructions? And if they say no, the two of you put your head together and you ask, why do you think that's happening? Is it that the person's anxious? Is it that they don't care? Is it that they don't believe in it? They're in denial? They blame their employer for firing them? You need to know if the treatments are working.
Correct. And that's the mysterious world of traumatic brain injuries. And thank you for being on our show. Thank you for bringing some knowledge over here. This is Dr. Shirin Ansari with Brainworks. Your clinic is in Irvine?
Yes.
Fantastic. Well, if you guys need a neuropsych out there, Dr. Ansari is my choice. I think I'm going to make an appointment after this interview because I desperately need her. And thank you for joining us on PI today, and see you later.
Thank you, Dr. Nick.
Thank you.